Disable meeting room.
Okay. So where are we here? So the poisonous substances produced by fungi are known as mycotoxins, secondary metabolites. So not related with their multiplication or their viability or their reproduction, not related with. So this toxin causes the condition that is known as mycotoxicosis. It's mycotoxicosis. So examples, what are mycotoxin and what condition caused by the mycotoxin? The number one is mushroom. Mushroom. Some of the mushrooms are not edible. They are poisonous itself. For example, the mushroom Amanita species. They are poisonous. They produce the poisonous substances and then they cause the condition known as mycetismus. The mushroom poisoning is known as mycetismus. So this is very toxic, and this cooking temperature cannot affect on the cannot destroy the toxic effect of the mycotoxin. This Amanita species. So it can cause. All right, it can cause fatal damage to the liver and kidney. That's why in some cases after eating mushroom they died. So the one toxicosis is mycetismus due to Amanita species. So another one is Aspergillus flavus, Aspergillus, you already know that Aspergillus is a dimorphic fungi, right? So this Aspergillus, the species flavus, produce the toxin, although called the toxin, it's a toxin, is a poisonous substance, This is known as aflatoxin. So this aflatoxin is carcinogenic. So it can cause sea liver. Aspergillus, flavus, is frequently contaminate the peanuts. When you crush the peanuts, the crust, the hardened, what is a shell. So inside is a red bean, right? Sometimes you will see the fungus. This is not good. And also chilies, the chilies. When it is dry, when you remove it, you see the seeds, chili seeds are contaminated with fungus. These are aflatoxins. So this aflatoxin are poisonous as well as carcinogenic. It is associated with sea liver, and it is associated with carcinogen is associated with liver and gallbladder. Is thought to be, it is assumed that this is a mutation of the P53 gene. P53 gene is the oncogenic gene, right? So P53, change to cancer, CA liver, and CA gallbladder. So this is a morphology of Aspergillus. You already know that in year 1. So these are the conidia, asexual spores. This is a infective form to human. When we inhale this conidia reach to the human body and then change to yeast form and cause the diseases. All right. So now you know one is one of the mycotoxin is mushroom. Mushroom poisonous substances causing mycetismus. Another one is Aspergillus species, Aspergillus flavus producing alpha-toxin. So the third one is Claviceus purpura. So these fungi grow and rye, and then they produce the toxin or poisonous substance that is known as argotamine. You may be you already know that the argotamine is the argot. Argot is the medicine. used for the treatment of the bleeding, especially during labor, after immediately after childbirth, we need to inject that alcohol intramuscularly to the mother, so that no puerperal bleeding, postpartum bleeding. So this is a vasoconstriction effect. So this alcotamine, this is a very little dose, physiological dose. So this one is, if it is high, it causes the poisoning. That is alcohol poisoning. Alcohol poison or alcoholism. Alcoholism present with high fever and hallucination, and convulsion and gangrene because of severe vasoconstriction. Even can cause death. So if we use the what is called the right dose, very low dose, we can use for the treatment of the control of bleeding during childbirth, and also for the treatment of migraine, very severe headache, migraine, and also can use, it is not good, induce abortion. All right, all about mycotoxin. So just for information. So now we do for the intestinal worms. For that, I want to have your participation, and then if you can, I want to see your face. Camera on, please. Otherwise, very boring. The one way teaching every day. Every class. That the problem of online teaching. So, can you have your microphone on, and also camera on? For a little, now is, I think, 15 minutes, 30 minutes out of 40 minutes. I did half finish. So can I see your face? Round one, Hazila, because I know your name. On it. All right. I also, all of you to participate, for the scenario case. Thank you. Okay, so case one. Case one. I need to read. You read yourself, or I need to read for you, or?
Can I read it, Dr. Otto?
Okay, thank you. So,
case scenario one: a 5 and malnourished boy was brought to ED of a general hospital following a 3-week history of nausea, poor appetite, and abdominal pain. He had not had any bowel movement for the last 2 days. Story of passing earthworm-like structure a week ago. Nation, a febrile, light pale positive, blood pressure 102/52 millimeter per mercury. Abdominal examination, abdomen distended with mildly tender. First, most likely diagnosis. Second, test to confirm your diagnosis. Fourth, life cycle and sign and symptom. Fifth, treatment. Sixth, and prevention. So guys, what do you think about this test scenario from the statement given?
Fast. Don't take too much.
I think the key point is malnourished.
All right.
And history of passing earthworm-like structure.
So, earthworm is, what is the shape of earthworm?
Wiggly something.
Do you know this? What is the earthworm? Long and
segmented.
Is it
round worm?
round,
No,
round?
you can see segment. No, I'm not sure if you want to see under the micro. No, this is the earthworm is round worm, not segment like cestode. So it is a earthworm is long, it is rounded. So this is roundworm passing from the anus. History of roundworm passing the anus. The age is 5 year old, thin and malnourished boy. So malnourished. So what is your most likely diagnosis?
Probably infection of Ascaris in the because
Even you don't know the genus, you can say what is it? This is a worm intestinal
Yes.
hemodialysis. No? You can say this is a roundworm intestinal worm infestation, right? So how will you confirm your diagnosis? Malnourished, 5 years old, malnourished, abdomen is distended. So maybe they have many worms in the body, in his intestine because of malnourished. Usually worm infested child are like this, thin, all the worms taking nutrients from him. So how will you diagnose?
Stool
and
culture.
the stool.
Stool.
Okay. You will do the test you will request the test for stool examination, right?
Yes.
Yes.
No? Take example of the stool and make a test for these two, microscopic and macroscopic. No, the stool examination macroscopic, you have to check any worms present or not. No, and after that, microscopically, is there any ova or eggs of the round Ascaris, right? Ascaris, the another name is roundworm, no? Giant roundworm. So you have to check any Ascaris eggs or not. How many Ascaris egg do you know?
Only one line.
How many Ascaris egg? Different types of Ascaris egg. Shahira. I saw Shahira, so I asked Shahira, how many Ascaris cannot recall?
2.
All right, so now you know this is a ascariasis. How is the transmission? Transmission?
Oral fecal route.
Fecal oral route, no? The ingestion of the foods and drinks contaminated with Ascaris egg. No? This Ascaris egg is the egg containing embryo or larva. No? So when the Ascaris egg pass from the patient, this egg is not embryonated egg. No, this egg is, here you see, this egg is only segmented ovum, no, fertilized egg or unfertilized egg. That's all. This fertilized and unfertilized are not effective to the human. No? They need to develop on the soil, no? To develop from the ovum to the larva stage. No? So embryo, no? 1 to 2, 2 to 4, 4 to 8, finally the larva. No? This is egg containing rhabditiform larva has to be developed on the soil. Now this will take about 1 month, no, round about 1 month, no, 3 to 4 weeks. So the egg just passed from the patient is not infected yet. So you must be clear that one, no. So the soil for the maturation of the egg, no. This egg, ovum, this is a fertilized. Fertilized is containing ovum. Unfertilized is atrophied ovum. So atrophic ovum all died out. Ovum have to develop on the soil with the temperature, right humidity, develop in form, and then this is the infected stage. This contaminated with food ingested. So from the intestine, when larvae hatch out, so they can migrate to the lungs, heart lungs migration. So why they move to heart and lung migration? So this larva have to mature another maturity stage. So after and then swallowed and reach to the intestine. So and then at this stage they can develop into adult worm. All right. So this is just a revision. Revision or revising again. All right, this is a male, female. So that's why. So signs and symptoms. The signs and symptoms caused by larva. Larva stage you can find in the lungs. So maybe Loeffler's syndrome, or the respiratory tract pneumonia, and then adult worm is inside the intestine. So adult worm inside the intestine, nutrition, something like that. All right. So I think you can recall back. This is the case scenario 1 about the ascariasis. Symptom treatment. You need to know which antihelminth drugs are used to treat the is general. Okay, scenario 2. I have 4.
Zila.
Shahira, can you repeat?
Yes, yes. Okay, for case scenario 2, a mother of a 3-year-old child came to the clinic and complained that her son was having abdominal pain and loose motion off and on for more than 2 weeks duration. She told that she noticed her son was scratching around the anus and saw many tiny whitish worms passing through his anus at one night. The most likely cause of this condition is most likely. Okay. Then, well,
And off and on the
This what?
Off and on is, what is called, not always. Sometimes lose motion and then back to normal, then motion. So off and on. All right.
I think this question is in our SEM 2 exam. I still remember it. The answer is the vermicularis something.
Yes. This is correct. This is around the semester. This semester 2 exam. You or out of you 20 students, right? Only 2. I think only 2 or 3. I think 2 can get the diagnosis. So I'm not blaming you. Some of you are now in year 2. Some most fail in my portion. Most of you are fail in my portion or something like that. So you revise again now in year 2. So what is it? 3-year-old child. Abdominal pain. Loose motion. Loose motion off and on means that sometimes have the diarrhea, abnormal stool. Sometimes is normal stool. Loose motion off and on more than 2 weeks duration. So her mother said, notice that the child is scratching around the anus, scratching, especially at night. Those small whitish worms passing through his anus. So this is the diagnosis. What is it?
vermicularis.
Vermicularis. Enterobius vermicularis.
Vermicularis. All right. Enterobius. This is enterobius on or pain one. So why is scratching? Why the child is scratching?
Because this is retro infection
Through
Auto infection kan.
auto-infection, ada infection tu. Retro, what the heck?
retro infection.
Okay, retrograde. Why retrograde? The gravid female, when they want to hatch, lay the eggs, no, they need the oxygen. So the gravid pregnant, gravid is a pregnant female have to go up to get the high oxygen, no, from the innards and then lay the eggs. These eggs have the itchiness, not itchiness because of the maybe we produce the proteins or something like that, no, very itchy. The meeting was so we need to upgrade. I upgraded. I don't think I can get it. Oh, I can upgrade. I'm not sure. Dollars. They ask me dollars. All right. So diagnosis is entropias, no? Entropias or entropiasis. How to confirm the diagnosis? What specimen? Sorry?
Eight detection.
I don't remember the you know, using tape, ada
Scotch tape.
All right. So what specimen you want to take? What test you want to do?
Stool examination.
Huh?
Sample.
Microscopic examination. No, you need microscope to this is the entropias egg or not, right?
Yeah.
So you need the microscope. So you have to do microscopic examination of the microscopic examination. So what specimen you want to collect? Loose motion. So maybe you can take the
Stool sample.
stool sample, and then you have to find out for the entropias egg. No, entropias egg. All right. Now this is a life cycle entropias. No, so egg, and then ingested. No, the important one is when entropias egg passed. No, just lay the eggs, no, from the gravid female. So the egg containing larva, the egg already containing larva, wait for the maturation on the soil. No? When the hatch on the perianal skin, this mature into larva. So this larva, not because of very itchy, and child scratch it. When they scratch it, larva contaminated and then reach to into their body again. No, so that's why. So that's why you can take the specimen of the stool, but stool you can get it only 10% of infection. You can diagnose only 10% of the cases. So the only thing is because if you take the stool, the larva is on the perianal skin. So you have to take the swabs or cellophane tape, the cellophane tape. You know the sellotape, right? So sticky, one side is sticky. And the sticky side, put it on the perianal area and then put it on the slides. One mix with 1 drop of saline and look under the microscope. No? So if you take the sample of the swab from the perianal skin, you can diagnose 90% of infection. So this is you need to notes or your textbook. All right. So this is about entropiasis. So another only 6 minutes. Read. I will read. Like, you are working in the rural medical clinic in China, and 3-year-old girl is brought. So the child is emaciated. Upon testing, found to have hemoglobin of 5%, very low hemoglobin, meaning that the child is the child from the rural area have anemia, high level of anemia, and feet and ankles are swollen. The swollen, maybe edema, I don't know. And there is extensive rash on their feet and ankles and knees. What is the most likely parasitic infection in child condition? So the intestinal worms associated with anemia.
Oh,
What is it? Hookworm. No, this one is maybe because of rash and her feet, because of the penetration of the larva. Now, in this case, the infected form is filariform. No, this is a hookworm egg. No, on the soil, have to wait to mature. No, around about like ascaris, maybe a month, 3 to 4 weeks, and then of larval development, first rhabdidiform, then filariform. This filariform larva penetrate the skin. No, infected route is mode of transmission is by penetration. That's why the child have what is called the rashes or something, swelling because of the penetration of the larva. So this hookworm, 2 species, Ankylostoma and structures, and then they attach to the intestine. Then they suck the blood. So if it is chronic infestation, and then the size of the body is high, right? So the heavy infestation, it can cause anemia. All right. So geohelminths, so soil transmitted geohelminths forms. They have to develop their eggs, their life cycle. They need to develop on the soil. So that is geology, is a soil, studying of the soil. So soil transmitted helminthiasis caused by geohelminths. All right, case scenario 4. Only 3 minutes left. Okay, read. Island, read.
Europe had lived in the United States for over 15 years, presented with a of left-side weakness and onset of seizures. MRI of the patient's head revealed like this.
As a Peru and live in the United States now, years ago, so maybe chronic, infection, or and the left-sided weakness and onset of seizures. Attacks, epileptic attacks. This is the MRI. What is it?
Cystirosis. Cystirosis.
Like this. Like this. What is your diagnosis?
Cystirosis.
Cystic
Cystirosis.
The larval stage is cystic. Sarcosis is caused by
Teniosodium.
Teniosodium. Our form of Teniosodium. So this is cystic. So this is the life cycle. Cystic. If the cycle is completed here, this is the clinical condition is Teniosodium. The adult worm is inside the human. In some cases, this larval stage that usually occurred in a cat animal can also happen in the human. So that's why the human can act as well as say intermediate host. No, definitely host is carrying adult wall, in host is larval form. No, in case of Dynia solium, no, the human can act as host. No, so this is the cysticercosis. No, I think I need to finish. No, the time is less than 1 minute. No, that's all. No, so all the information, no, about worms. No, all right.
Tolong.
Okay.